Hi, I'm Dr. Raymond Douglas, and welcome to our Beverly Hills Infusion Center. I think infusing TEPEZZA specifically, but with myself and my team, is really a special experience, and it's really unlike anywhere else in the country. We provide everywhere from start to finish monitoring, in addition to help with insurance, in addition to concierge care, as you're going to see in this video. And we really wanted to walk through step by step as to what you can expect in this infusion center with Dr. Douglas. So really wanted to welcome you, and I think you'll enjoy, hopefully, this experience and see how it's really different than any other. Hopefully you've had a chance to kind of see the environment, etc. But I wanted to kind of cover overall what to expect. So long before anyone ever arrives to our infusion center, they've had appointments with me via telemedicine or in person or both, where I can diagnose and recommend treatment. And we'll talk about that in a separate video of how that happens. But once you're approved for TEPEZZA by our insurance team, and by the way, our insurance team handles everything for you. They make sure that you're registered for copay assist so that you don't have any co-payments for this treatment. They make sure that your insurance authorizes the treatment, and we make sure all the billing is done for you. So this should be a very hassle-free environment so that you can come and you can receive your treatment without worry. And you've seen in the video that hopefully you come and you have a very good experience. You have a private room, and you can sit for about anywhere from 60 to 90 minutes during the infusion and do work or reading or whatever you need to do to pass that time. It should be a painless experience. Most patients really tolerate the infusion incredibly well, but we monitor your vital signs every 15 minutes. We make sure that the infusion is safe for you by doing all the screening laboratory testing. In addition, we also monitor you during the infusion process to make sure that you're tolerating this drug very well. And that includes checking your blood sugars on occasion. We also offer hydration therapy. Some people notice fatigue and muscle cramping with the therapy, and we'll talk about that in a future video too. But this can often be really dramatically improved with hydration therapy. And we offer that here as far as a vitamin and hydration therapy, in addition to just practical tips that you can go home and use on your own. All the infusions are monitored by me personally, and to make sure that your experience is great, but most importantly that we're taking care of you medically, that we're monitoring and making sure that this is improving your condition. So it's usually a very easy experience, and then a very easy transition of care to make sure that I'm following every aspect of your thyroid eye disease to make sure we're back on track. And we can always offer other therapies as we go along or after your infusion, but I think it's really important just to understand that we really try to make this a concierge, easy experience. Most of our patients actually fly in from out of town, and they fly in, have the infusion, and even fly out or spend a little bit of time in Los Angeles. But we're happy to help, and we're always available. Thank you so much.
Hi, my name is Mary, and I'm going to tell you what my infusion experience has been. So I've had Graves for a while, and the infusion therapy was really my best option for restoring my normal appearance. And I think anything that you do that's new might be slightly scary, but I've noticed that I come in and I feel very comfortable. The nurse that's been with me, Maria, has been amazing. She makes me feel comfortable about every step of the process. So I just basically come to the office and I get to sit in this fancy chair and I can bring whatever I need to entertain myself for the time that I'm here. So I sometimes read, I sometimes do work for school or work on some stuff that I'm interested in, hobbies and whatnot. And it goes pretty fast. So I don't feel anything different or weird or scary. I feel it's super easy. It's just an IV, and I'm needle averse most of the time, but Maria has been the best IV inserter that I've had, and so it hasn't been even painful for me, and I'm actually very, very grateful. I've noticed a lot of improvement, and so the small trepidation I may have felt, I am completely grateful that I've done it, and I recommend you do it too. So what I've noticed, the changes from the infusion therapy, I don't know the mechanism by which it works, but Dr. Douglas explained it to me. I'm just not adept at repeating it. But I've noticed that my eyes have gotten softer, and I actually had, my left eye was worse and different than my right eye, and they're coming into some symmetry now. So whatever is happening from the infusions, is softening that swelling or softening that tissue that was making my eye different than this one. And so when I look in the mirror, I see a way more normal appearance, and I don't have to feel devastated about it. I feel more hopeful. So what I've noticed, the changes from the infusion therapy, I don't know the